My name is Dr. Lida Panagiotopoulou. I am a consultant psychiatrist. I work in the NHS and also privately. I was a doctor already, and I needed to choose a specialty. And I thought psychiatry is the most interesting because it's about people's behavior and thoughts and feelings. And I just find it so very interesting, and possibly more interesting than thinking, oh, how does a heart work or this type of thing. It's about building a relationship with the patient and have a very good understanding of their personalities and their feelings and thinking patterns. And I find psychiatry very rewarding because I'm able to help people and make a very positive difference to their lives. So many of the conditions people come and ask help for, with proper treatment, they do get very much better. A very good example is ADHD, where it's brilliant that we give a tablet and it makes such a positive difference to most patients. I find that very, very rewarding. I'm a very compassionate person. I want to have a good understanding, establish a very good relationship with my patients, and also make a plan together with them. So my approach is to provide all the information to them so they can make an informed decision, a decision that makes sense in terms of the science and what we can do in medicine, but also takes into consideration their own values and priorities and when acceptable to them. Like some people like psychological treatment, some people like more medication, or they may want both. I like having this approach of continuously improving, if possible, my practice, the service that is provided by my team specifically for the NHS, and I want to hear from patients what works and also how we could do that better. So feedback and constructively using that with a view to continuously improve and make what we do better. In terms of what I value for my patients, my patients are patients really that are there to get help, and I'd say it's more about me having an understanding what their needs are and meet them. So some patients may want to be informed and make their own decisions, and some other patients may say, you know, doctor, what would you recommend? And it's about them explaining to me what they need, and I'll take it into consideration, make sure there is a plan in place that meets their needs. Psychiatry is quite unique. I'd say what makes it different is the complexity and the uncertainty. So there are situations that can be very, very complex, and also there is a degree of uncertainty that is higher than other specialties, maybe because our understanding of how the brain works is not as advanced as our understanding of how heart works or kidneys work. So it's important for the doctor to be able to deal with the complexity and uncertainty. And I believe that because of the way my mind works, I can do that very well. So with the complexity, it's about having that analytical way of thinking that understands all the elements of the human behavior and thinking patterns and way of people feelings, and just put it all together and understand this complexity, but also be able to make a concise formulation of the points that are most important. And with the uncertainty, it's again a matter of understanding it, being aware of it, and be okay with it and just make the most that is possible in each situation.